Guys, welcome back to Medical Coding with Blue. Today's episode is all about which medical coding specialties can you gain the most experience from. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So the three main ones I'm going to be discussing today, these different medical coding specialties, are going to give you a variety of experience rolled into one. I will also talk about some additional specialty medical coding clinics that I think are really good and are going to give you a lot of opportunity if you really pursue those. All right, so here we go. So the very first place that I recommend if you are wanting to get a lot of experience rolled into one, and this is for my brand new medical coders, it is also for veteran medical coders who have found themselves kind of in the same rut, if you will, the best place to go would be the ER. The emergency room is going to give you the opportunity to code not just for diagnoses, but also for procedures and HCPCS coding and evaluation and management. So there's a lot of different things that are covered in the ER. Now, the ER, you see everything, and I do mean everything. You see accidents, you see heart attacks, you see pregnant moms coming in. You see a lot of different things when you're working in the ER. So you have to be able to switch on and switch off a lot of these thought processes, and you have to know how to code in the different types of things that happen, like your injury coding, or for mother baby, you have to know how to code for those mamas, okay? Those pregnant mamas that come in and maybe they get sent on to the mother baby place. You want to make sure that you know how to code them when they are coming into the ER, because sometimes they're not always going into labor, they have other things going on. So it's important for you guys to know that. And in the ER, they have to get an evaluation and management level. They're going to get whatever procedures they did in the ER, and they're going to, of course, get all of the diagnoses. Now, because it is like the wild, wild west in the ER sometimes, things do get crazy, and therefore the documentation can get a little crazy as well. So this is a great opportunity to exercise your ability to be able to do queries. Now, because it's the ER, and a lot of times there's a lot of things that are not recalled because there's so much going on, it is a great place to get to know your providers, so that way you can kind of keep up with what is happening. And if you are able to educate them, sometimes it's a certain person who's designated to do education in the facilities, and other times it's up to the medical coder. I prefer being up to the medical coder, but then not everybody is the same, okay? So if it is your responsibility, this is going to give you the opportunity to make sure that you put out different things so that it's not all this information all at one time to overwhelm the providers, but it is going to be just a variety of things, and it's going to be in little small bits so that way they can absorb it a lot better. Like when you're talking about educating them for when a pregnant mom comes in, and let's just say that she had an injury and she fell. Obviously she's not in labor, but you do have to follow the rules of coding for pregnant mothers. So if it is, if they're saying that this injury is not incidental to their pregnancy, of course they need to put that in there. And if they don't, they need to at least put how many weeks is that mother, you know, how many weeks is she pregnant, and that kind of thing, and all of the other information that goes into that. So that is something that you can educate your providers on. If they're, of course, seeing a lot of injuries is a huge thing, and it should be a constant bit of conversation that you're having with them. The date of injury, if it is that same day, okay, how did it happen? What do we know? What is the most information that we can get from this patient? Is this a work-related injury? Is this just a car accident? Is it just a home accident? Where did it happen? Because oftentimes insurance is looking at these documents from the ER, and that's how, you know, they need to get all that information. So if this happened in the course of their work, they need to have that in the documentation. If they were injured on the job and that kind of thing, it needs to be in there. If this was because of a car accident, again, it needs to be there. If they were at home and, you know, they fell off the ladder and that kind of thing, again, all of that needs to be there. So as much detail as we can possibly get about these injuries, and you can help your providers to set up a template, you know, if you have that ability there at your facility, to set up a template so that when there is an accident, they know what questions that they're supposed to be asking, so that way all of the information can be there. All right. So again, that is very important. There's a lot of modifiers that go into those procedures that happen in the ER as well. Sometimes there are and sometimes there's not. So really you have to go and look at those modifiers and pay attention to what is pertinent to what happens in the ER, all right? That's just one thing that you got to know. But it is very exciting. And again, it's going to give you exposure to multiple different specialties. So if you find yourself at the end of like a year of being in the ER and you say, hey, I would like to move on, but you know, I really enjoyed my time, you know, working with all the accidents. And so I really want to pursue ortho. Hey, that is a great segue into working with ortho, because obviously working in the ER, you have had your exposure to all of those accidents. It's the same thing if you want to work podiatry. Podiatry also deals with accidents of the foot as well. So working in the ER, that experience will carry you over there, because again, you've seen everything, all right? But maybe you don't want all of the action of the ER. Maybe you're like, well, Blue, you know, maybe I want to try something a little bit, you know, it's still variety, but not as exciting as what's, of course, going on in the ER. Then professional fee coding would be for you. Now, professional fee coding, that's making sure that the provider is getting paid. The rules change a little bit. It's still outpatient coding, and so is the ER. They follow outpatient rules. But with professional fee coding, the patient is going to be located in the hospital. They are in a bed in the hospital. This professional provider, right, professional fee, but professional provider is going to be going up to the inpatient floor, and they're going to be seeing their patient. And so all of their services are not going to be ICD-10 PCS, but instead it is going to be your CPT book. That's where your CPT book comes into play. And they also have evaluation and management. You will see that under your hospital stay in there, right? In your CPT book. So you'll see it under initial hospital and subsequent hospital, and of course your discharge. So you have your evaluation and management that you can practice while you are coding for professional fee. You will also have the procedures that the provider performs, right, if they perform any procedures. And you will also have the diagnosis coding naturally. Now, professional fee is not just one particular service. It is multiple services. So you are coding for everything, again, like the ER, right? But with professional fee, it is, you're looking at the MICU, you're looking at ortho, you're looking at podiatry, you're looking at cardio, you're looking at neuro, psych. All of these different specialties are going to have those professional fee services provided by providers that are coming in to see the patient that's inpatient on the floor. So that's why it's going to give you a variety of experience. Now, some places, they will have a group of coders who work in a specialty like that. And other times, it's going to be maybe one person or two people. So it really all depends on, number one, the size of the facility. And then number two, it's going to depend on a lot of other factors. How often are they rotating and looking at these patients and that kind of thing? Are they staying there for long stretches of time and that kind of thing? So there's a lot that goes into it. But whenever you see we're looking for a pro-fee coder, that is what you're going to be exposed to, multiple different specialties. And again, when you're looking at multiple different specialties, you are also looking at multiple different procedures that you're going to be coding for. So that's another really good way to pack in a lot of experience in one sitting, right? Because you're not just coding for a specialty, which coding for a specialty, there's nothing wrong with it. But when you have varieties like the ER and like Profi, you're going to get a lot of different things that you have to switch on and switch off. Again, you're looking at mother baby, you're looking at all of these other things, right? So the Profi clinic is a great way to also get a lot of experience at one time. That was my second job. When I became a medical coder, I worked for a temp agency, and the second position that I got was working at a hospital, and it was working for Profi. I didn't know I was going to be working in Profi when I got there. They just kind of sprung this on me because they said, hey, they need coders. Okay, here I am. Let's go. And so I'm ready to code anything, because when you have been certified as a medical coder, this says that you have displayed the competence that you understand how to code everything, right? Because our medical coding certification exams are not just on one specialty. It is literally testing you on everything, okay? And I had my CCA at the time, which I will always say the CCA is a great certification because it tests you on a lot of things. And the CCA, out of all the medical coding credentials out there, covers the most, all right? It covers the most, and it is the shortest exam. But don't let its size fool you, because it packs a punch. And you have to know what you're doing when you take the CCA exam, all right? Because even though it is entry level, again, those people that have that certification have to know a lot, all right? And again, that's where I started, and I will always say that is a great credential, okay? But working at that Profi clinic, in the Profi clinic, when I was at my second facility, when I got there and they offered it to me, they said, look, we have all of these specialties, but they asked me specifically, they're like, Blue, what do you think of working in Profi? I'm like, I don't care. I'll take anything, you know? And they go, but we want to make sure, because we've had people quit because of this specialty. Nobody wants it. Everybody says it's hard. And I said, I have been a coder for 3 months. I moved away from home, hours and hours away from home, and I have got to make this work. So it's sink or swim time. I can get this. You just, I mean, if I have questions, obviously, you know, she's like, oh yeah, you know, I'll help you. I'll train you. So my boss is a very good trainer, and I learned it and I picked it up right away. And I made that clinic my own. Right? I made it my own, and I was able to learn it, and I was able to learn my providers and have conversations with them. And this was a teaching hospital, so I spent a lot of time with residents as well. So that was a lot of fun for me. But again, it gave me a variety of experience, because it wasn't just one specialty that I was in. And you have to have those rules of, the patient is inpatient, but it is outpatient medical coding rules. Okay, so that was another thing that, okay, I could wrap my head around this because it made sense. And because of that, I was able to get to my forever home here. And that was where I started, was in the Profi clinic. And so, you know, that experience helped me to get here. And again, I had such a wide variety of experience. It really did look good on my resume. And that's what you want. Every single job that you're going to, whether you're working for a temp agency and you're working at different specialties, or maybe even one specialty, all of the experience that you get is going to be filler for your resume. And I certainly had filler by the time I got done working at my second facility, right? And so having all of that experience in Profi, it made me less fearful of going into different specialties, because I knew if I could master working in the Profi side, or the professional fee side, I certainly could master working in a specialty clinic full time, all right? And so that's where it will make you less afraid. Then you will be able to have options of coding anywhere. I am not afraid to code anywhere, because I know that all I need is maybe just a few weeks in order to get myself like familiar with the procedures that go on in that clinic and the disease processes that are common in that clinic. And that's when you can basically work anywhere. So that's why I don't have fear, guys, about working anywhere, because I've done everything except for like interventional radiology. But when it comes to evaluation and management, I have done that. I have done procedures. I have done, of course, diagnosis coding. And so when you have that experience and that background, you know, it does make you more well-rounded. You're not just like trying to stay in one bubble. You are open to code anything, all right? And so the last one that I do recommend, if you can get in there, same-day surgeries. So same-day surgeries might seem a little daunting, right? But of course, there's no evaluation and management in same-day surgeries because it's all surgeries, right? These are all surgeries. And of course, you can reference your CPT book to see all of those that are there. But with the same-day surgeries, again, it's multiple specialties. It's not just one service. It is going to be multiple specialties. So maybe sometimes you may have a full day of like colonoscopies, or you may have a day of just spine surgeries, or you may have a day of just like appendectomies and things like that, working on other parts of, you know, the gastrointestinal system. Or maybe it could be even where they have those the gastric bypass. So there's just different things. And sometimes it'll be this plastic surgeries. So there's all different specialties when you're coding for same-day surgeries. Same-day surgery, if you, the name tells you, these are surgeries that can be performed where you're in there and then you're out. Same day, right? Because it's same-day surgeries. And so those surgeries that are like that, you know, those are the ones that are, okay, we can code these for same-day surgeries and that kind of thing. So again, a variety of experience is going to make you really strong, because to code surgeries, you have to think, and you've got to be able to read these op notes. And while you're not working with evaluation and management, again, you're not working with that, you're concentrating and really, really focusing on those surgeries. And so that's something that you will gain lots of experience on. If you get really good with surgeries, again, that's going to blast open doors for you, because there's a lot of people that are fearful of same-day surgeries. They don't want to do it. They say, well, Blue, no, I'm scared. You shouldn't be scared, because when you get familiar with surgeries, and there's so many things to help you learn surgeries. The best thing about YouTube is there are tons of surgeries that are online that you can watch. And the more that you watch these, the more that you listen to what is going on, you're going to notice that a lot of the things that are written in these op notes are going to make more sense, because, or much more sense rather, because you see them and then you hear them. And then when you see it in writing, you're like, okay, oh, I know what's happening here. It's not just words on a paper where you're just looking for words to kind of fit for this surgery. You're actually going to understand what's happening. And once you understand what's happening, that's going to make it a lot better for you to get the most appropriate code. Or if you need to query, you're going to know what you need to query in order to find out what's really happening with this surgery here. So that's very important, and it's a lot of fun. I've done that. I've done same-day surgeries before, and when I first got put in it, I was intimidated at first. I was like, oh my gosh, what do I do here? And so I started to use the coding companion. I also used the Coder Desk reference for procedures. There's the one that Optum360 has, Optum360 Coding. They have that. This is not an ad for them, but HC Pro also makes theirs. It's not HC Pro, it's Decision Health that makes their own plain English procedures book, right? So it explains everything that's happening in these procedure codes, and it's broken down by code, by CPT code, and it tells you everything in layman's terms, what's covered in that procedure. So it does help you to understand, you know, what's happening when these procedures are being reported. And so again, knowing the procedures is going to help you to ensure that the provider is going to get all the credit that they deserve, right? Because you're going to know what's included and what's not included. The CPT book will tell you, do not code this additional code in conjunction with this code, because that's telling you right then and there that it's part of it, so it's bundled, right? And then you're going to be able to know what's bundled and what's not bundled when you do your research, you know. So same-day surgeries, again, are great for brand new people. I wasn't in coding very long when I was doing same-day surgeries either. So if you say, well, it's because I have no experience, they don't want to hire me. No, that's not true, because I was coding for same-day surgeries not even 6 months into being a medical coder. Okay, so that's just something that you should know. Some of the other specialties that will get you a lot of experience in just a short amount of time: family practice All right, you'll see a lot of different things that go on in family practice, but it's not as crazy as, of course, the ER, because these are people just coming in. Sometimes they're coming in for a well woman visit. Sometimes it's for like a sprain. Sometimes it's for a cough, and sometimes it's for shots and that kind of thing. So there's a lot of variety, again, in coding for family practice. And they have all the things, of course, evaluation and management, the diagnosis coding, and of course HCPCS coding. All of that goes on in family practice. So again, it's a great place to get a wide variety of experience, so that way you have all of that to be able to put on your resume. Some of the stronger coders, though, they do code for orthopedics. I know, because not saying that, oh yeah, I'm trying to float my own boat, but the thing with orthopedics is you have your organic conditions. The body does these things like osteoarthritis. And then of course you have your injuries. So it's two different hats sometimes you're having to think of. And then you're looking at the documentation and how is it worded? Because if you look, sometimes you'll see there's an organic code, an organic meaning there's an M code, the M section, right? And then you'll see there's an S code for the injury section. So it really all depends on the documentation and how it's documented, which one you're going to pick, and that's how you're going to do it right. There's major surgeries, even though they don't go to the OR, but they do have major 90-day global procedures that are performed in the clinic when they are putting on a cast. If you look at that, the closed treatment for fractures is going to be a 90-day global period. It's the same thing for podiatry. Podiatry is another one. Evaluation and management, procedures that performed in the clinic, and of course your diagnosis coding. And so again, both of those, ortho and podiatry, cover organic conditions and they cover traumas. So that's another place where you can get a lot of experience. Mother baby, okay, that's another one. OBGYN. Pregnant mamas, they have a different set of codes that they've got to use, like I talked about before. But it is a great place to get a wide variety, because pregnant mothers are not just, or they're not just covering just, oh, it's just a baby. They often have other conditions like obesity, or maybe using tobacco or alcohol or any of those other things that affect them. They sometimes have rheumatology conditions as well. So all of these things, they have all of those specialty codes for OBGYN. That's something that you have to think about. And again, having experience in something like OBGYN is a really great place that can get you a wide variety, and using those different hats and that will look really good on your resume. So those are just some of the ones that I do recommend. Of course, cardio is a really great place. It is very intense, but not all places have like a whole cardio department. All right. At my facility, we do not have one. So that's something that you have to kind of look out at different facilities. So that's something that you need to look at when you are applying. But again, working in ortho or podiatry or OBGYN, that's going to give you a wide variety. Family practice is also going to give you that wide variety as well. So whatever clinic you find yourself in, make it your own. Learn as much as you can about the procedures that are performed in that clinic, and learn all the things that the new technologies, and learn about the different procedures. And that's going to set you up for success. At least that's my advice anyway. So I hope you've enjoyed this episode. Best wishes to you out there on your job search and your journey. Take what you can when you are learning. Okay, guys, take what you can and learn what you can while you can. All right, and never be afraid to start something new. All right, so I'm going to wrap this one up. Thank you guys so much for joining me, and I will see y'all next time. Bye.